Hello, I'm Dr. Maria Cilindro, integrative anti-aging medicine, and I'm practicing in Pasadena, California. Today, I would like to welcome my guest speaker. Her name is Dr. Shyrlena Bogard. Hi, Dr. Shyrlena.
Hi, how are you?
There you go. Okay, I'm good. Thank you. Let me introduce who Dr. Shyrlena Bogard is. Dr. Shyrlena Bogard is board certified physician specializing in OBGYN. Graduated from Chicago Medical School in 2006. After her OBGYN residency in Eastern Virginia Medical School, she spent 7 years of her career doing OBGYN in Illinois until I think they finished her OBGYN in 2010. She realized quickly that there is a void in sexual health care service. She aspired to provide a compassionate and non-judgmental environment to her practice and came to California in 2017. She offers telemedicine and in-person service. In 2019, she started her own company called Intame Inc. Today, she's helping us to understand some of the hormonal issues and also abnormal menses as an OBGYN physician. Right, Dr. Shyrlena?
Yes,
Shyrlena, yes.
yes. Thank you so much for having me.
And look at her t-shirt. It's called Into Me.
Into me.
Into Me.
All about the relationship you have with yourself.
That's right. It's Into Me comes from intimacy within me or with me.
No, well, so I'll tell you the backstory of it.
Okay, please.
When I was in Palm Springs, we had a clinic and it was Intimate Wellness Institute. And whenever we would do Facebook ads, they would throw them out because Facebook wouldn't accept the word intimate. They don't accept intimacy, intimate, or anything like that because it's a family platform. So when I branched out and started this, I said, well, I still want the intimacy in there. And so I came up with Intime because, as we know, the most important relationship you will ever have is the one that you have with yourself. And so my practice is all about helping people to have a healthy relationship, whatever that is for each person, so that they can then be in a healthy partnership with someone else. So into me.
Thank you. You're very visionary. Yes. Now, Dr. Bogart, when it comes to menses or periods or menstruation, all women associate these abnormal situation, if there is any, to a doctor like you, OBGYN.
Mm-hmm.
If not, their primary care who also offers women's health. How many types of menstruations disorder are there and which one is the most common one? Because today's topic is an abnormal menstruation and we are going to talk about menopause and andropause.
Right. Thank you. Yeah, it's a really good question. And when it comes to abnormal periods, there are, we could name off hundreds, but in the world of gynecology, we categorize them into two main categories. Either they're caused by structural causes or non-structural causes. And so we have an acronym that we use. It's called the PALM system, PALM, just like your hand. And so the PALM, the PALM, those are all of the things that would be structural causes of abnormal periods. So that would include things like polyps, which are abnormal growths inside the uterus itself. The A is going to stand for adenomyoses. Adenomyoses is a condition that some women have where the lining of the uterus actually starts to grow into the muscle, and then they will have really, really heavy and painful periods. And so that's the A. L would be leiomyoma, which are fibroids, which we know are very, very common in minority and ethnic women, non-cancerous growths. And then the M would be for malignancy. So cancerous and precancerous conditions that happen within the lining of the uterus. And those are our structural causes. And then we move over to the non-structural, which is our COIN, COEIN. The C stand for coagulopathies. that would be bleeding disorders. So anyone who has like a hemophilia, who tends to bleed a lot, any of those bleeding disorders. The O is going to be for ovulatory dysfunction. Some women, for whatever reason, they may have hormonal abnormalities where they're not ovulating every month. And so what happens over time is they can have a buildup of the lining in their uterus, and that causes abnormal periods. And so ovulatory disorders. The E is for endometrial causes. You can have an infection inside the uterus itself, or other things that can cause abnormal bleeding. And then there's a category we call iatrogenic, the I. Those are the things that we cause. So meaning I put someone on a birth control pill, and so now I've caused some issues with her hormones, or stuck an IUD or something like that inside. Those would be those iatrogenic, like everything was fine and then we went and manipulated it. And then the last one is the N, which are not otherwise categorized, meaning we're really not sure what's going on, but we need to do more investigation. So generally there's lots of causes, but they tend to fall either within structural or non-structural causes.
So make it easy. Palm and coin.
Palm like your hand, and OEIN.
Yes. Thank you for the explanation. And what can be the cause of the abnormalities in menstruation? And is it dangerous to our health? I think you did mention the cause of the abnormality. I'm not quite sure if they are terminology that are difficult to understand, but is it dangerous to our health?
Overall, having an abnormal period in and of itself is not dangerous, but if left untreated, you can become anemic, meaning you're having, really, really heavy periods and losing too much blood every month. And that can cause some anemia, which can cause some health disorders. Also, if there is an underlying thing like a cancer that's not treated, then as we know, that's going to cause some problems. And so the bleeding, the abnormal period in and of itself is not so much of an issue as much as what's causing it and what can happen if it's left untreated.
Okay.
You ask what's the most common cause? For younger women, the most common cause of abnormal bleeding would be anovulatory cycles, meaning they're not ovulating every month. For older women, it's going to be the hormonal issues, being perimenopausal. And so they have the hormonal abnormalities that are causing the abnormal menstrual cycles.
Okay, thank you. For some women who might wonder because they do not have this abnormality, let's explain about what is considered an abnormal period.
That's a good question. So the best way to figure out what's abnormal is to define what's normal. An average menstrual cycle is anywhere from 21 to 35 days. So everyone should be having a period anywhere from every 21 days to every 35 days. And the length of bleeding typically should be anywhere from 2 to 7 days. So if your cycle's more than 7 days, that's going to be abnormal. Most women lose about the equivalent of a third of a cup of blood over the entire period. I know in a pad it looks like a whole lot, but if it's ever measured, it's about, 3/4 of a cup. What that looks like conceptually is if you're using a maxi pad or tampon, you should be changing it no more than about every 3 to 4 hours. If you're filling up a pad every hour, every 1 to 2 hours, that's too much bleeding. Also clotting. Some women will have clots, some won't. Small clots should be about the size of, when I was young, we had silver dollars. I know a lot of the kids these days don't know what silver dollars are because they don't make them anymore, but about the size of a small plum. If you've got lemon or plum size like this, that's too big for your clots, but they should be really, really small. So if you're having bleeding more than 7 days, if you're changing your pad, filling it more than every 1 to 2 hours, or if your periods are coming every 14 days or coming every 60 days, those would be considered abnormal.
And okay, so what are symptoms of this menstrual disorder or abnormal menstruation? Is there any pain? And how,
Um,
yeah, how to
dep-
manage it? Yeah.
Yeah, so especially when women have very heavy periods, sometimes they can have more pain associated with those periods because that uterus just contracts so much with those heavy periods, and they will tend to have heavy and painful periods. That's going to be the most common thing. And then also, if she's losing too much blood, she's going to have increased fatigue. Her energy is going to be lower because she's losing so much blood so quickly. Increased back pain, which we know is common with periods, but also those can become more intense. And even bloating. Bloating is something that women will sometimes, when they're having heavy periods, will get more of the systemic bloating symptoms that we experience.
Mm-hmm. Yeah. Thank you so much. And do you think they should see a doctor right away when they think that that is their problem, or when would you want them to see a doctor?
So typically the first time it happens, I wouldn't go to the doctor because it's not abnormal to have an abnormal period every once in a while. So if it happens once and then the next month everything is fine, then I wouldn't be too concerned. But if you're consistently seeing it, you've had 3 abnormal periods in a row, then definitely you should consider seeing your doctor. But then also, if you are having where you're soaking through a pad every hour, even if it's the first time, because that's just too much bleeding, that's something you do want to make your healthcare provider aware of, just because it may just be an infection or something that needs to be treated.
Okay. Now you did mention that this is not too bad unless there is like cancer or something like that. But is there any way we can prevent these abnormal menses in any of them?
Well, because the most common cause of abnormal menses is associated with hormonal abnormalities, one of the things that women can do is to adopt a lifestyle, adopt a nutrition that actually helps to support a healthy hormone balance. So what I usually have my clients do is go on anti-inflammatory diets. And so we're taking away things that cause inflammation in the body, because inflammation can cause hormonal abnormalities. And what that looks like is taking sugar out of the diet, taking, sometimes decreasing alcohol, things like that. But stress. And I think stress is one of the things that sometimes we don't consider. But when you have high stress, it changes your hormones, and actually that can affect your cycles as well. So for a woman to the things that she can do is adopt a healthy diet. So getting rid of and what the way I always tell, because I try to keep it as simple as possible, is eat foods in their most natural state. So get rid of processed things. If it comes in a box, if it comes in a can, you probably want to stay away from it. You want whole foods in their natural state. And then you want to make sure you're drinking plenty of water. And if you are having issues, getting an exam with your doctor and looking at some of your hormones and making sure there's something that does not need to be addressed.
Yes, I agree. Thank you so much. That's the integrative part, which is very good. Now, you did mention that stress can affect the period. And does it affect your sexual function in women or men?
Oh, most definitely. It affects both, actually. What happens when you're stressed is we tend to release more cortisol, which is our stress hormone. So when we release that stress hormones, it shuts everything else down in our bodies. So unfortunately, our body is not very good at figuring out different types of stress. It doesn't know the difference between not sleeping or being chased by a bear. So when we have stress because you haven't been sleeping, or let's say we have a stressful relationship, or we have stress on a job, our body still thinks we're being chased by a bear. And if we're being chased by a bear, we don't need to have a libido to be trying, to have intimate connection with our partner, or we don't need to be trying to make babies, or we don't even need to be losing weight. So our body is holding on for dear life to protect itself from its perceived danger. And unfortunately, all stress in our body, all stress is the same. So a lot of people think, well, it's just a little bit of stress, but any stress can shut down our libido. It shuts down our ability to burn fat. It can shut down our ability to heal ourselves when we get sick. It causes us to not be able to manage emotionally things. We tend to overreact to things a little bit more, which affects relationships. And this is for men and women. And if when you start talking about how it affects your hormones, the more stress you have, the less testosterone your body makes. And testosterone is important for libido for both men and women. And when we have low testosterone, we're going to be less inclined to want to be intimate with our partners.
Yes, yes. Now, the stress that you're talking about, is it like a daily stress or is other than the daily stress? Because everyone has stress, especially now.
It's more of the chronic stress. So we do, we want cortisol because, let's say, when we injure ourselves, we want our body to mount a response to come in and heal that. But it's a short thing. The body responds to this stressor. Once it's taken care of, the body says, okay, we're okay again. But when you have the constant stress and it never comes down over time, that gets overwhelming for the body because you never have that recovery period. And it's the recovery periods is when our body is able to reset itself and heal itself and make testosterone and do all of those things. And so when we don't have those recovery periods, that's when we start to have these issues.
Okay. So can you tell us, well, as an OBGYN physician, you probably know this, what are health problems related to these abnormal menstruations?
One of the most common causes is having thyroid disorder. So women who have either hypo or hyperthyroid, both of them can affect your menstrual cycles. Typically, if a woman has low functioning thyroid, her periods will be much heavier. If she has high functioning thyroid, then she'll have the little short periods that are really light. But thyroid disease is one of the most common things. And so usually when a woman, that's the first thing we check when a woman has abnormal periods. One of the other things, as we mentioned, is having bleeding disorders. So a lot of times women may have von Willebrand's disease. It's one of the most common but undiagnosed things that women can have. And typically we don't diagnose it. It's either diagnosed when a woman has a dental disorder and she bleeds too much, or when she has her first baby and she bleeds more than we're expected and we end up doing a workup. But any type of bleeding disorder like von Willebrand's or having a hemophilia, those things can cause her to have heavier periods. And then any hormonal abnormalities. And so having too much estrogen or too little progesterone, those things can cause also some cycle disorders.
Okay. Thank you so much for explaining. Now, I'm not sure about your reading as like an Asian woman. They don't know about this premenstrual, but they do have PMS they don't know about premenopause or menopause, but because it's very, I don't know, maybe culturally that they not notice that, but they do have the premenstrual syndrome, which is, when they were young. Is this dangerous to their health, and how to prevent this one? Because many young people, they have this problem and they do not know what to do.
Right. And so PMS, premenstrual syndrome, it's typically a constellation of symptoms that women notice in the second half of their menstrual cycle. So right before their period comes on, they tend to have increased depression, lots of bloating. Sometimes the motivation goes down, lots of anxiety. We get a little bit of it normally, but with PMS, it's lasting. It comes on up to a week before the period. And it's sometimes so severe that the woman just can't function. And so in those women, that can be associated with a vitamin D deficiency. So sometimes that's one of the first things I'll do is check a vitamin D level and make sure that's normal. But also Some women may need to have some hormonal support because they may not be making enough progesterone. And by supplementing the progesterone, that helps them to alleviate those symptoms. And then for a small number of women, we have to look at other things like birth control pills or lifestyle modification always is a part of it. Sometimes by looking at her diet, if we adopt a more carbohydrate diet, not cakes and sugar. I tell people not the cakes and cookies, but simple fruits, the carbohydrates from fruits and things. Those women, sometimes that can actually alleviate some of their symptoms just by having more carbohydrates around that menstrual cycle. And if she's having bloating, giving her a mild diuretic to help with the water retention. Is it harmful? Not necessarily is it harmful to her or her health, but overall, if it's affecting her ability to enjoy life, then it's going to affect her well-being. And so anything that's going to decrease your ability to participate in life and go to work and enjoy life is going to decrease your well-being overall. And so if a woman is experiencing these symptoms, then definitely she should have a conversation with her healthcare provider about ways to manage it so that she can continue to enjoy her life.
Now, I know you are much more like baby compared to our age. When we went to medical school, we did not learn about magnesium, iodine, and zinc for these abnormal menses. But did you learn it in medical school that magnesium actually helps this PMS?
No, I actually, everything that I learned after residency when I started getting more education in the integrative medicine field. And so most of what I've learned as far as managing hormones and these things has come from my integrative medicine studies.
Yeah. Okay. All right. Except I know for sure the introduction of protocol magnesium for eclampsia and pre-eclampsia, it was not during ours, but it's during yours.
Yes.
Have it, right? Yes. Okay. Now, with the new technology, many have written and many have said that men are talking about handling the electromagnetic field devices that gives them an effects. And for women, of course, it's too early of menopause. And some women went into menopause at the age of less than 40. Yeah, what are the signs of this premenopause or early menopause? And is it affecting our health and dangerous?
So yes, that's one of the things. And I actually had a client recently who had stopped having her periods at 39. And she just thought it was normal and so unfortunately, when you have premature, so the normal age to go through menopause is the average age is around 52 to 55 is the average age to go through menopause. And most women, you can look at when your mother went through menopause, if she didn't have a hysterectomy or anything, to predict when you would go through. So for those women who go through premature menopause, meaning they stop having their menstrual cycles before age 50, those women will also have other hormonal deficiencies. And so they may have thyroid deficiency that needs to be addressed. But also when you have premature ovarian failure, which is what that is, so that means your ovaries have stopped making hormones too early. What happens is you have an increased risk of having osteoporosis because we need estrogen to maintain our bone health. But it also increases a woman's risk of cardiovascular disease. As you know, cardiovascular disease is the number one killer of women over the age of 50. 1 in 3 women die from cardiovascular disease. So if a woman goes through premature menopause and she does not receive any type of hormonal supplementation, bioidentical hormone supplementation, she does significantly impact her health overall from those lack of hormones. And so it does affect a woman's health when she stops having periods too early if her ovaries are no longer making hormones.
So then you adjust the hormone.
Yes. And so typically if I have a patient who comes in, and we would look at her hormones, but we would also look at thyroid function and look at adrenal function, because those things kind of all go hand in hand. And
Yes.
we want to make sure if there's anything that we're supplementing everything and keeping her healthy, keeping her optimal as though she was functioning. She won't necessarily get periods back, but we're making sure we have enough hormones to supplement her brain health, her cardiovascular health, her bone health, so that she is healthy overall.
Oh, yes, yes. Thank you for that explanation. But now let's touch a little bit about these men which have the same hormone except a different amount than women. So the andropause is the terminology, which is when male becomes menopause or decline their hormone to a level, to a very low level. So the androgen hormone, which mainly is testosterone depleted, what
Mhm.
are their symptoms, and is it the same as women, and can this affect their sexual function?
Yeah. So the main difference between how men present and how women present, for women, we tend to all of a sudden hit a wall. Like we'll be feeling good, and all of a sudden our hormones drop because our decline is so steep in our hormones. For men, it's a very gradual decline. So most men at around the age of 30, their testosterone production starts to go down about 1 to 3% every year, every single year.
Not
So
bad.
depending on his lifestyle, the more stress he has, the faster that goes down. The healthier he is, the slower it goes down. But because it's going down so slowly, his body can kind of compensate where he doesn't necessarily feel the symptoms. And typically what he'll start to notice is, they'll start to put a little bit of weight on the midsection and getting the love handles where he may not have necessarily had that before. Then their energy starts to go down just a little bit. But again, they contributed to work and not sleeping and all those things. But it's when they start to have erectile and libido issues. And so at some point, he may not wake up with the morning erection. And that's usually what brings men into the clinic, is the morning erection and the erectile difficulties when that testosterone gets low enough. And so sometimes if it's someone who's very into his weight, that will bring them in because they're eating healthy and exercising, yet they're still putting on that spare tire and they're like, what's going on? If it's someone who's very in tune to their body, but otherwise it's usually someone, once that libido starts to go down, that men will notice. But again, it happens so gradually that I would say the average would be around 45 to 48 when men start to, okay, yeah, something's going on here. I need to go see what's going on.
So they don't have any insensitivity, or like, some women, we tends to be more sensitive when we have premenopause symptoms. How about men?
I would say it's the opposite. They tend to be a little more aggressive. Um, with the low testosterone, and unfortunately, I'm not saying unfortunately, but what can happen is they will have higher estrogen levels. And high estrogen in a man looks a lot like high testosterone in a woman, and that there's more aggression. And so it's not necessary that they become emotional or weepy, is they respond to stress a little bit. They're overreact to stress. They're patient and more aggressive.
I see. I see. Okay. Now, many women thinks that having period is youthful after they turns 40, 50. So they are not happy when they found out about their menopause stage. Oh, I don't have my period anymore. How to prevent symptoms of PMS or menopause or andropause uh, in terms of epigenetic, like, environment and eating and all those. Do you think this will actually affect, their symptoms, and so they feel okay?
Well, as far as going through menopause per se, I haven't seen anything that we can do from a lifestyle epigenetic standpoint that's going to maintain the cycles. Sometimes some women who are on hormone replacement will start to notice some cyclical bleeding. But that's an intentional thing, that where they're taking the hormones to cause that. As far as the symptoms go, and it's really hard sometimes to predict who's going to have symptoms and who's not. There are women who you look at their hormones and they have no estrogen, no testosterone, and she's not feeling anything. And then there are other women who get every single symptom in the book with the hot flashes, the night sweats, moodiness. And so it's really hard to predict. I can say, though, on average, a woman who has a healthy lifestyle, so she has a healthy, what we call whole food diet, she gets adequate rest at night, regular exercises. So I think is one of the most important things people can do is getting regular, moderate level exercise. Maintain not drinking too much alcohol and drinking adequate water. Those women tend to have fewer symptoms when compared to women who don't have a healthy lifestyle or, don't have a healthy diet. I will say when you compare the groups, although the variance ranges in both, the ones who have that adopted the healthy lifestyle tend to have less severe symptoms than those who don't.
That's right. Yes, I
And the
agree.
thing with men, I've had, men who 55, 60 years old, and you look at their panels and they have the testosterone level of, when they were 30. But then when you look at their lifestyle, he doesn't drink, he exercises every day, he practices meditation, he has a healthy supplement regimen. And so lifestyle tends to be a very, very good predictor of who's going to have severe symptoms versus those who do not.
Yes, thank you so much. I noticed that also. Now, thank you, but there just a question here. Maybe we take care before you give us the take-home message, okay? Let me see. There's one. Do young women like 20s and in their 30s ever need compounded products like progesterone or testosterone or estrogen? This is
yes. So one of the things that we are seeing more and more is hormonal and ovulatory cycles, and that's in women of all ages. So when women first start having cycles, so when they're teenagers, their first 2 years are usually anovulatory. So the cycles are irregular because they're not ovulating regularly. But after about 2 years, most women will start to ovulate every 28 days and have a cycle. Because of our environmental exposures, we have so many things in our environment that affect our hormones that many younger women and men are starting to have hormonal abnormalities. And so and stress levels that they have, those stress levels are either depleting their hormones or causing hormonal imbalances. And so because of lifestyle and exposures, we are seeing that younger and younger men and women are needing hormonal supplementation to help balance out or optimize them back to optimal levels.
Yes, thank you so much for that. And of course, they have to see a doctor where they review their hormone, right?
Yes, and one of the things, and it's kind of, we have to say this is, when you see a physician for managing your hormones, you want to make sure it's someone who understands hormones. A lot of women, we think that our OBGYN is the best person to go to. A lot of us did not receive training in managing hormones. And so I would say to seek out someone who specializes in managing hormones. And so when patients will ask me, what kind of doctor is that? The 3 titles they usually go by is an integrative medicine,
yes,
an anti-aging, or functional medicine. So those are the 3 titles that doctors will tend to go under if they are an expert in managing hormones. Now, some OBGYNs have gotten extra training, and so I would have that conversation. But if you feel like your OBGYN, you ask the questions and they're like, everything's okay, everything's normal, then I would seek out, a second opinion from someone who is an expert in assessing hormones.
Well, thank you for that explanation. For everyone who understand what that means, Dr. Shyrlena Bogard is integrative OBGYN. Okay, so that's all of us whatever specialty we have, we can actually study or learn more in the integrative medicine part, which is a fellowship basically. Now, it's already 30 minutes and past, so can we actually have your take-home message, Dr. Shyrlena?
So yes, I say this, I do a lot of talks about hormones especially, and there's so much confusion, and I tell patients, and it doesn't matter what we're talking about, is you are your best advocate. You are your own advocate, and you have a right to have answers to your questions. And so, and the best way for you to have an intelligent conversation with your healthcare provider is to get knowledge. And so, like when you, Dr. Maria here, this is such a wonderful platform that she has that gives you information, that answers questions, because you can take this information and go back and have a conversation with your healthcare provider. And if you feel like you're not getting the answers that satisfy you, it's okay to ask for a second opinion or to go to someone else, because your health, you are the person who's going to advocate for you most. And you want to know that you are doing everything possible to make sure that you are healthy, because you have one life and one body, and you are the only person who's going to make sure that you take care of it.
Yes, I agree. Thank you so much for that take-home message. I hope everyone gets it. And Dr. Shyrlena, oh,
it's always my.
I think it's a little bit of the internet. Okay, now Dr. Shyrlena Bogard is still active helping people with sexual health, and she's available in her Instagram and Facebook for while transitioning her practice from full-time OBGYN to just consulting and helping people in their sexual health. Okay, please give thumbs up for like and share this video with your friends. I really appreciate it. And Dr. Shyrlena, can you please tell them how to get a hold of you just in case they need your service?
Yes, contact me via Facebook or Instagram. Both are just my name, Dr. Shyrlena Bogard. That's DrShyRlena, B as in boy, O-G as in George, A-R-D as in David. And they both have direct links to schedule consultations on the both of my social media sites.
Excellent. Thank you so much. I'll see you next week. We'll have her again, and the topic is more interesting. Thank you. Bye, Dr. Shyrlena.
All right. Have an awesome evening.
Thank you. Bye-bye.